So good morning, everybody. Thanks for joining us. And at least this isn't the 8 o'clock hour, which is a little harder for people to get excited for. Welcome to my training today, or facilitation of this discussion on motivational interviewing skills for particularly related to vaccine hesitancy. And so I'll just give you a brief introduction of myself, and then I'll ask Susan if she can introduce herself as well. You've heard from Emily, and some of you may know me from trainings I've done over the years for public health. And what my background, so you wonder why I'm talking about this, is that I'm a retired communication professor and a current communication consultant, which I developed those careers concurrently. So I've been doing that a long time. And this is a subject I've taught in a number of courses, but for the last year and a half, I have had the great joys, the ups and downs of being a COVID-19 response coordinator for the state health department. And so I just wanted to let you know that while this subject is taught in a lot of fields, this is designed specifically for vaccine hesitancy. And although I am not a first responder provider or an administrator of such a facility, I want to let you know I'm not coming into COVID-19 cold, not understanding angry people, hesitant people, people who want to argue with you, all those kinds of things. I have handled the phones many times and am familiar with those things. So that's just a little bit about me. Susan, could you do an introduction, please?
Sure. I'm Susan Reeser. I'm the nurse consultant with the immunization program here at the state. And I have definitely seen a need for this training, specifically with COVID, but in years coming. And so those of you out there who have been administering vaccines have felt this hesitancy on the scale, and we're very happy to bring this training to you. And we are also, I'll let Julie address this later, if there are more people, we do have a waiting list. We are looking at providing this an additional time. So please be sure to let us know in your feedback if you would like more spaces and other trainings related that you may like to go along with this. So thank you, everyone.
Thanks, Susan. And to follow up on that, I realize with a large group, part of why we capped it is I don't want it to be all talking head. The way I teach is interactive. We'll have 2 breakout times, nothing really big, but I think that's how people learn best. So that's how we're doing it. And we're super excited when people say at the end, we want more. So we'll create more if this interests you. So that said, all right, so here's our agenda for today. We've already completed introductions, or at least most of them, and may still have some coming in. Then the next item will be to define motivational interviewing. And if some of you are thinking, well, I've already heard of it, that's okay. Because what I've decided is that with the general audience, and I don't know where you are, if you've seen it or studied it before, it may not have been as it relates to COVID, it may have been, but it will be enough of a review that I don't think you will find it bothersome. And if you have not heard of this particular type of skill, then there is enough here for you to be able to build upon the other topics for today and to be able to look at the skills and strategies involved. So I didn't want to assume that everybody knows what it is. I also put the MI in parentheses because you always define an acronym first. We're all state and county and health workers, and we use a lot of acronyms. So if I say MI, you'll know I mean motivational interviewing. Then we're going to take a look at briefly at the vaccine dispositions that patients, clients come in. We'll talk throughout what some of the benefits and the challenges that are involved when we're doing motivational interviewing. And then we're going to talk about something called OARS, and I'm going to identify what that stands for. It is an acronym that stands for, the O is for open-ended questions, A is for affirmations, R is for reflections, and S is for summaries. And you don't have to memorize that. It's going to come up on a slide later. We are recording this, so you'll have lots of options to remember that. It's also something, there's a ton of literature out there if you want to learn more about it as well. Then there's something called EPE, and that stands for elicit, provide, and elicit. And we'll do an example with our group itself just briefly in a little bit. So elicit, provide, elicit. And then there are several other tools that I'll introduce where we scratch the surface a little bit, but it'll allow you to take a peek at some of the examples that we have to use them. And at the very end, we'll have an evaluation. And when Emily does the wrap up for today, she'll put that link in the chat. And I believe that she sends it out to you in your emails as well. And I would really like to encourage you to do that, especially as we're going to offer more of these. I have a thick skin and we want to know what you want more of or what you would like that needs to be improved. And we'd also like to know what you enjoyed about today's presentation. All right. So the learning objectives today, I boiled down to three main things. First of all, I'm going to say the term provider, and you might have a different role, but you get the idea. Part of this presentation was developed from something that was put on by the Department of Health in Colorado, and they use the word patient navigator. And I just want to say provider. It feels more comfortable to me, and whatever role you are, many of you are providers. So as a provider, to be really noticing the patient's readiness for vaccination. Now, I know sometimes this doesn't take a lot of sleuthing. They come in and tell you right up front, that's how things are. Absolute yeses, absolute nos, but there's some nuances in there. Second, an objective to leave today with is to be able to explain various ways that you could use the MI skills. And then I mentioned spirit there because we're going to talk about what's called the MI spirit regarding vaccine hesitation. And then the third objective would be for you to be able to leave this presentation being able to identify and practice skills to either mitigate or we'd all love it if we could resolve vaccine hesitancy, but maybe you just get them a little bit closer. Maybe you don't resolve it all that day, but those are the three main goals for today. So what is motivational interviewing? And so one of the things I wanted to talk to you about is I'd like to just ask if anybody wants to either just unmute and say what you think it is. It doesn't have to be an exact definition. I'm just wondering what you think it is, or you could type it into the chat as well. Okay, well, I will tell you some of the best ways to understand it. And this was originally developed by someone named William Miller. And this was used for several other subjects. That's why I put fields where it's used. And that is the idea that you use some techniques to understand someone's resistance to a behavioral change. Now, the CDC has developed a definition that they have on their website as well that's looking specifically for identifying the concerns that people have that may keep them from making that behavioral change. Other fields where behavioral changes have been addressed by using this skill or the skills of these would be things like substance abuse or getting people to smoking cessation. Also, maybe behaviors related to sexually transmitted disease, asking people to make a behavioral change. So it's been out there a long time. And I date myself when I do this, but I've been teaching for 30 years and I've taught this subject in a number of courses. So one of the things I'd like to put a nuance on this is it's taught as a skill that we use when we talk, but it's actually more about listening. And I am going to emphasize that throughout the process. So it's a way to look at what people's concerns are and to draw them out either verbally or non-verbally, or to notice them and be able to use that so that you can be the best provider that you can with the goal of getting them vaccinated. Now, I'll talk about why you might be thinking, oh yeah, right, like I got time for that, or all the reasons that you might not want to do that. I'll be talking about that momentarily. In general, it's a three-step process. First of all, you're assessing that disposition. Maybe they came in for something else, but you're still assessing that disposition if the subject comes up, or you know that they are not vaccinated. Then you use motivational interviewing skills to talk and listen to patients. And the and listen is really important. And then to make a plan. If they come to you with the disposition that they're pretty ready, but have a couple of questions, of course, you hook them up to getting vaccinated. And even if they are a solid, hardcore no, there are still some options for how to leave the door open. So I mentioned earlier the MI spirit, and this alone, if this was your only takeaway and you don't remember the details of the ORs or the EPE or a particular open-ended question, if you have this guiding you, that's why it's called the MI spirit, is that this will help you. There is no perfect way to do this. You're practicing it all the time. You practice medicine, you practice being a provider. It is not perfect every day. And this has certainly not been a perfect couple of years. And so you do the best you can. So a couple of items, 4 items listed of the MI spirit is talking about the autonomy of the patient. I realize how very difficult this is. Montana's one big small town. And if you're not, a couple of you mentioned that you talk about COVID all day long, every day, for the last year and a half or 2 years or however long you've been doing it. But I'll bet many of you have found that it isn't just at work. They can grab you at the basketball game, you run into them at the grocery store. And I have felt that way for a year and a half doing COVID response coordination. And I've done everything playing bench to whether it was an epidemiologist or help put in your MIDAS data. I might have been handling the actual vials of the samples when we first started and helping drive them to the airport at 9 o'clock at night with Jim Murphy. So all of the different things, I get how hard this is, but the other person is still another person and they get to be who they are as much as we might want them to think something else. Collaboration. If patients can get the feeling that you are there walking alongside them and not judging them for the viewpoint that they have. Again, since we don't have potential patients or clients in this training, I can say to you that we've all thought in our head or perhaps out loud, are you kidding me? I can't believe you think that. Where did you get that information? That's crazy. I can't believe someone told you that. But when you're interacting with them, you want the patients to feel that you are in this together. Evocation, that is to evoke responses from them. Now that's different than an interrogation. We're going to talk about asking open-ended questions. You are not trying to ask them questions like, well, why would you think that? Or where did you get that information? Just my nonverbal, my verbal, already that person's going to feel judged. And if any of you have ever been someone has tried to persuade you to do something you don't want to do, the more they judge you and push you, instead of saying, oh, yes, I see I see the light, I'll come over, you actually just back yourself into a corner and want to fight harder. So trying to get responses from them that will help you and having compassion for everyone that comes in. And I've learned in working in public health a lot that you all wouldn't be in this field if you didn't already have compassion. I know that the last year and a half has drained just about all that we have, but it can still be there and it can still help your patients. So I am going to stop screen sharing for a moment and pause this. All right, so I wanted to talk about that elicit, provide, elicit for just a moment, and I'll probably review it later. But for example, I'd like at least a couple people to answer this for me, whether it's chat or out loud. So what would be your resistance to learning about these skills? And I'll give you one example. I do not have time for this.
So there's a comment, sometimes it feels like it's pointless to even try. And another person said, I'm a man and inherently a poor listener. Thanks.
Way to own that.
Emily says, this isn't the way we've always done it. Like that mentality. This isn't how we've done it.
Yes. Yes. Okay, good. Those are good examples. Anybody else want to throw anything out there?
I would second it feels pointless to even try.
Yeah, it feels pointless to even try. For me, I would imagine, you're over it. We're just over it. I'm here to give shots. I'm not here to convince anybody of anything. It's my job is to give shots, or my job is to do this. And you think, what? And pointless to try. I get all of the things. The man and importantly, inherently poor listener. I'm going to say that's also a training you could take, is on listening skills. We're not inherently a poor listener. However, so if I want to find out what your concerns, I just asked you, what are some, I didn't say, do you have any reservations? I used an open-ended question and said, what reservations do you have about learning something like this? Now you gave me some answers. So elicit and provide, we just did. And then elicit some other feedback. And if I said, well, what if I gave you, how would you feel about me giving you some tips about how to make this easier and not so pointless? You might say, well, I'd sure like it to help a little bit. And whatever those answers are that you're thinking through right now, I just want you to know that this presentation, I feel like, is an example of motivational interviewing skills for all of you to say, maybe I'll give this a whirl, in the same way as someone might say, well, maybe I'll go ahead and get that COVID-19 vaccination. So just another way to look at that. All right. And I'm going to come back to sharing my slides. And so if you can just be patient with me here for a moment. So you can see me, correct?
Yes, ma'am.
All right. So I'm going to have to go back to this, and I'm almost there. I don't have the split screen. So if you can just be patient with me, I'm going to share my screen now, and you're going to see just a couple things to allow me to share it. And we will go back to the ORS slide and play from current slide. Everybody see the slide again?
Yes.
Okay, thumbs up. All right. So I mentioned ORS before. You see the big letters, the open-ended questions, the affirmations, and reflections. So a couple of things I'm going to talk about are some ways that, what are some open-ended questions? And I'm going to give you a couple of examples when you're, and sometimes what you don't want to do is get a yes or no answer. So you wouldn't want to say something like, would you like some information on how the vaccine was developed? Let's say their concern is that it was developed too quickly. You might be able to get there still, but if it could just say no, they could just say no, or they could say yes. But you might say, if it's all right with you, how would you feel about me sharing some information about how the vaccine was developed? And they might say something else. You could say something that's not stated like a question, but really is tell me more what you have heard about being at high risk for getting COVID-19, as opposed to, because you have diabetes, you're at high risk, or that because you're immunosuppressed, you might say, how can I help you find more information? How can I help you evaluate the sources that here's a couple of other things, affirmations and reflections all tied in together, this one. It sounds like you've been doing some of your own research, and I appreciate that you would do that. Is there any way that I can help you? Can I help you in some way to evaluate the sources that you are looking at? One I heard that I thought was really great is, how might things change for you if you were to get the vaccination? So let's say, and we'll talk about this more, you hear someone talking, they don't want to get the vaccine, but they have a spouse or an elderly friend or parent or grandparent that they want to be able to visit. And you've picked up on something they've said about that. And you might say, so your grandmother is vaccinated. how might things change for you in terms of visiting her if you were to get the vaccination? You might get an answer, well, I'll be able to travel where I want to go. We've heard a lot of things recently that although a lot of people like to work from home, a lot of people might say, I might be able to get back to work sooner. I might be able to travel to a state that has stricter regulations than we do, those kinds of things. So you might get all kinds of answers. You might even get someone say, maybe I'll just feel less scared if I get it. I'm just so scared and confused all the time. So affirmations, you're not affirming their viewpoint. You're affirming things that you hear them say. So it's, you're not complimenting them on believing that if they drink bleach that they'll fix it all, that kind of thing. You might say something like, so it sounds like it's really been a struggle having kids at home while one of you is on isolation and trying to work and all those kinds of things. And I'm not sure I could handle that as well as you have so far. And just affirming the place that they're in, reflecting back what they're saying. Now, a couple caveats. You don't want to use a therapist voice. So what I hear you saying is, no, you want to just talk to them like regular people. And you also don't want to parrot it. You want to be able to say back what you've heard. And then summary items. Summary doesn't have to occur just at the end of your conversation or your interaction or the visit. You can summarize items that you've heard all along the way. In fact, it might be the only thing that you can do. It's not like this is a 4-point process. These are just options. So a couple of summary things might say, I already gave you a couple. I said, sounds like you've been doing this and you're concerned about this. How might things change? You might conclude that summary with something like, did I miss anything? Or did I get that right? Or can you correct me if I haven't captured your viewpoint correctly? And that also shows that autonomy, that compassion, that collaboration of the spirit that's saying, I'm alongside with you in this. You may be thinking other things in your head, but those are the things we're not allowed to say out loud. I mean, we can, but it doesn't usually work. Like you said, feels pointless. I know that I don't like people in my personal life asking me questions because they know what I've been doing if I don't think they really want the answer. If they're trying to bait me into a debate, I decline. And I know you can't quite set that solid limit. When you have a patient, you have to answer in some way, but I'm not interested in getting into a debate. I am interested in being collaborative. And if someone in your practice or where you are is a hardcore no, I want you to know that you don't have to take that on. And we'll talk more about that in a little bit. So here's some keep in minds before we get a little further into some practice. These are, and I'm going to mention this later. Keep in mind the compassion that you're reflecting. I've mentioned that it's practice, it's not perfection. In my copious amounts of spare time, I teach yoga, and we call it yoga practice, not yoga perfect, because you are always getting better each time you try. Maybe you take one strategy from today and try it out. And here's the flat out no part. And I'll talk more about if I could make this a little easier for you. If you have someone coming in hardcore government conspiracy, doesn't want to hear about the CDC because that's the government too, and they're out to get us, and they're going to chip you, and they're absolutely, if you're just getting hardcore no's, I would like to really emphasize that is not your job to take on, and to depersonalize that as much as humanly possible. Again, I'll give more tips about that. But remember, it could be you. We could pick a provider from a different location. It could be me on the phone. They're going to do that to whomever they are speaking. I compare it to road rage. I once had people get really worked up with bad drivers. And I always say to people, hey, they would do that no matter which car is here. So back off. Just stay away from that crazy driver. Because taking it personal that they're trying to cut you off individually, personally, is really just gets you worked up. So maybe think about it like that, is that they would do this to whichever person was standing there saying it. So it's truly not about you. It feels like it, but it's not. Now, to the consideration of, I don't have time to do this. Do you have 2 to 3 minutes? And I put change after several dots there because the change might happen in the visit and it might not be until later. And let me suggest that investing the 2 to 3 minutes might ultimately make your job easier and less stressful, because you can walk away knowing you gave it a whirl and it might not work, and that still isn't about you. So that might lead to increased comfort for you in trying the skills. And ultimately, the more we do something, just like anything else, the more effective we become. So briefly, this will just take a moment. None of you are going to be unclear about this. This is part of the presentation that Susan and I watched from Colorado. And this graphic came straight from her presentation. And some of them come in ready to accept. They're ready. That's easy. Accept with questions. I'd like to get the vaccination. I'm just curious about how long I might be out from work because I know there are some side effects. And then you can go from there. That's not the easiest one, but it's certainly easier than the next two, which is they're very hesitant. And you may have to use more of the MI skills, more of the MI spirit. And if they flat out refuse, what have I said so far? If it's hardcore no, and you know you're not going to get anywhere, just don't assume that they are in the hesitant role. Because if you try the skills a little and they're still in refusal, then that's when you let it go. Don't let it go too fast. But if you decide to let it go mentally as well. Okay, so what I'd like you to do is take a moment wherever you are. I don't know if you have pen or paper. I would like you to jot down one reason you've heard someone say to you that they refuse to get the vaccine. It could be a reasonable one. It could be a crazy one, or why they are hesitant. And I am going to give you an example of somebody from when we did this on the 19th, and I'm going to put exactly what she said. She put in the chat, I know someone who is now magnetic. And then she put SMH for shaking my head. And everybody got a good laugh out of that, and they were right. So just jot one down for a moment. I'm going to pause. Okay, next slide. I put a few things that I've heard. I did not put everything by any stretch of the imagination because they're larger categories. Maybe their hesitancy is that they got misinformation. Who knows what site they're looking at? Several things could fall in that category. Maybe they misunderstood the information that they got. I had someone who has been in healthcare before who just last week told me they did not understand the difference between isolation and quarantine. And I realize we're kind of in a different spot now with immunizations being available, but I was surprised. They thought they'd had it explained and they didn't understand it. Anecdotal evidence. These are my favorite. I'll be at the gym and somebody will be decide to ask me because they know what I do. And they'll say, well, I'm not getting it because my cousin's son heard that they did this. And I heard that you can get COVID from getting the vaccination. I heard that you can die from it at a number of things. And then that leads into fear of side effects of, and it may be that they're just concerned about the side effects of the actual vaccination. And if you can have some comforting thoughts or comments about that, they might be able to accept what that is. In my head, I'm always thinking, well, it beats the heck out of getting COVID, doesn't it? But as someone who just went through the shingles series, I'm going to tell you that kicked my butt, but I know it's better than getting shingles. So the question now is what else? And I'm going to stop sharing. And I'd like to hear from some of you, either in the chat or if you want to unmute and say, one of the things you jotted down, what did you hear for reasons for hesitancy?
There's been a few in the chat. One of them.
All right, read those. Yeah, why don't you start with those, Emily?
Yeah, we've got, who knows the side effects the vaccines will cause down the road.
Mm-hmm.
There's one, civil rights.
Yeah.
It says PG effects, which I feel like is a provider acronym and I don't know what that means. But government politics, it will change my DNA. Those who are vaccinated are the ones spreading it. Oh, pregnancy effects. Sorry, thank you, Jane.
Pregnancy. Okay, gotcha.
The vaccinated people are getting sick anyway. I already got COVID, so why do I need to be vaccinated? So there's some good ones.
Okay. Anybody want to unmute and say something out loud they heard?
I have family, remote family, far out. That we're literally the whole like the tracking like chip.
Yes, that they put a chip in you. Yes.
They were convinced.
How about this one? I get told this all the time, and I just want to, I don't even know what to say anymore, is that hospitals, I heard hospitals get paid more for calling it a COVID death than anything else.
Yeah.
I see people nodding, things like that. So hopefully, I mean, I've heard every single one that you just mentioned. So there are lots of reasons we've all heard. And I hope some of these, at least, it's not that it's a good thing that we've all heard these things, but I don't know about you. It makes me feel a little less crazy that I'm not the only one who thinks, oh my gosh, am I the only one getting these comments kinds of things. So there's lots of reasons that people might want to be hesitant. So I'm going to go back to sharing my screen. There we go. Okay. I was better at it the second time, Emily. There we go. All right. So we go to the next.
Practice makes perfect.
I know, practice makes perfect. I asked other reasons that I was going to put that up when I went around that. No. Okay. So some common scenarios, the safety of the vaccine, the long-term effects. We mentioned politics, mistrust of the government. I didn't hear anyone say it today, but we did hear it in the last presentation, mistrust of healthcare in general. And some of that has to do with people of color. Sometimes it is just healthcare in general for anyone. Information that you don't know about. Sometimes you are presented where someone brings up information to you that you haven't heard or that you don't know the answer to. And we'll talk about that. But what I can say briefly is that just in the way they make up reasons they don't want to do it, don't make up an answer if you don't know it. You can always say that you'll follow up. You also can say, now that I can't speak to, but what I can speak to is you don't have to know every bit of the science. The process, I mean, it's nice if you know it, but if you're not sure, you can always pause and say that you will get back to them on that. And they will feel heard. They will feel like they are a person and that their viewpoint matters. And they have been prevented with inaccurate information. And Susan, here's where I'd like you to chime in if you would, because you have an example that kind of hits all these things. And I don't know if you're comfortable, if you want to follow up, tell us about the follow-up that you and I chatted about after the first scenario.
Well, the example that I had was, of course, I get mostly phone calls, and I had a gentleman call and say he was very concerned about his family getting COVID, but he didn't trust any of the vaccines. He didn't trust the government. He didn't trust Dr. Fauci, and he certainly didn't trust the Moderna vaccine, but he'd been doing his own research and that he would like to get the BCG vaccine, which is the tuberculosis vaccine they use in other countries. We actually don't readily use that here. It's pretty complicated to get a dose of that. So, and this was before I was really practicing my motivational interviewing skills, and there's many other ways that I probably would have handled it now that I've thought about this more. But I did talk to him a bit and say I hadn't heard that about the BCG vaccine. I would make some phone calls to see if he could find it, but not sure what I could do about that. And just told him that I would look and I would get back to him. And so I did have to call him back. And I did, and he was very appreciative. I told him that I couldn't get it for him. He would have to get it through a private provider if he was going to do that, but it wasn't used for that purpose. But at least he appreciated that I got back to him. And I could have talked more to him, I know at this point in time, and saying, it sounds like you're really concerned about your family. Let's talk about other vaccines that would be available to them, just leaving all of that open for discussion. And then Julie, I'm not sure if I covered everything you wanted there, if you had other.
The only thing maybe it's not, I'm not sure if it's something that you want to talk about, but when you and I were talking about going through the presentation from last time, you mentioned that there were some bits of information that he had that ended up having something to it.
Yes, there is.
So share, if you could share that, just because I think it kind of shows that, had well, go ahead, just share.
It has come to light, and I haven't read the detail of the studies, but there are some studies that have shown, particularly in some third world countries where people have been vaccinated for BCG before we had access to any of the vaccines. I'm not sure I'm going to use the right term for this, but there is some type of protection from COVID that may have been offered to those people who were vaccinated, sort of a cross protection. So there is some research coming out on that as compared to the vaccines that we've developed actually for COVID. They're probably more effective, but in particular for those vaccines in the countries where they had difficulty getting the COVID vaccines, there is something to that question and to his answer and what he was researching. So again, you don't want to be quick to judge of what the research was. It might sound unreasonable or kind of crazy to you, but again, we're just here to talk to them. We're here to listen and to try to help them move along the path.
Right. And so let's say that the reason I wanted you to share that piece is, let's say that in that callback, you had some more conversation and maybe you chatted about where he had heard about that, but it wasn't in a accusatory way or whatever. And like you said, you didn't know this. And this is an example of where maybe it's not the best answer that he would have done, but he was calling, I think, prior to the vaccinations coming out, or like you said, where people are having trouble getting it. What you could do motivational interviewing techniques by summarizing back. I followed up on what you mentioned, and I did hear that had provided some protection in certain cases. What I can tell you is that since then, and in blah, 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 these vaccinations might be alternatives to consider that may be more beneficial to you, especially to address the concerns you have about your family. And so, like you said, don't necessarily dismiss it, because I know when you and I first spoke after that, you thought, I just had some guy call about blah, blah, blah. And we both kind of giggled and went, oh my gosh. And so, yeah, you just never know what you might find out in there if you have a conversation. So thanks for sharing that. Okay, Emily, before I have this up, I'm not ready for you to play it yet, but what I'd like to do, we're going to watch about 7.5 to 8 minutes of the first part of a video. We'll watch the rest of it, but not right away. And what I'd like you to do is pay attention to see if you notice any open-ended questions, any affirmations, any reflections, or any summary. And then I'm going to introduce the idea of change talk, and I'll talk about it in more detail after we watch part of the video, because I think it's just a lot. Even though this is scratching the surface in this training, there's still a lot to learn. And so the idea of change talk is that as you're listening to the patient talk, do you pick up on anything that might be that little tiny piece of info, because you've got your listening ears on now, not your talking ear, you don't have your mouth going, you are listening. Is there some little piece that might give you an opportunity to do one of those strategies in the ORs? When we are finished watching the first clip, Emily will put you into breakout sessions and breakout rooms. And the Riverstone group will keep you as one group, and then everybody else will be assigned to a virtual breakout room. And then I'll have a slide up afterwards that talks about what to do in the breakout groups. It'll be about 10 minutes-ish, give or take. And I will ask you to talk about things that you saw that worked and things that maybe could have gone better. So that's the preview of the next little chunk here. And so with that, I've got the video links so that Emily is going to play that for you. Thanks, Emily.
No problem. Let me make sure that's clicked. All right, holler if this doesn't play.
Well, Ms. Jones, sounds like what we're going to do is we're going to just adjust the doses of your medicines for your blood pressure. Hopefully that'll keep things in check. It's great seeing you, and I'll see you very soon. We'll have you come back in like a month or so. Is that okay?
It is. It is. So,
Oh, I forgot to ask you. How's your mom?
oh, mom is she's okay. She's okay. I don't know if she told you during her last visit that we lost my aunt, her sister, due to COVID, and so it's been a really hard time for her. But outside of that, she's okay. I know she misses her sister so much because they talk like every day, especially during this time of pandemic. So, right now she's okay. Health-wise, she's okay. She's taking her medication. Just really missing her sister.
Yeah. Yeah. She feels isolated.
Yeah, she does.
Yeah.
She does.
Well, thank God she has you.
Yeah. I try to do the best I can. I love my mom.
Yeah. Yeah. But I said this to her and I'm going to say it to you. I'm so sorry for your loss. It's, this virus has really ravaged the community, Well, at least some good news is I think your mom's coming in 2 weeks and we will have the vaccine by then. So we can give that to her and we can also give it to you when you come in a month, because, you have diabetes. So you'd actually fall into the category of getting the vaccine. All right.
Okay. Well, listen, I can definitely talk to my mom about it. And she can definitely follow up with you if she has any other questions, but I don't think I will be taking the vaccine.
Oh,
Yeah.
okay. All right. You're not interested, huh?
I'm interested in my mom if that's going to keep her healthy, especially with this, with the passing of her sister. I'm sure she will, want to do whatever she needs to do to make sure that she's protected against COVID. To be really honest with you, Dr. Burns, I'm just really unsure. It just feels new. It's, I don't know. I've done a little bit of research and I don't know. To be honest, I'm just really not trusting. I don't know how else to do it. You know what I mean? I'm just really not trusting. You can barely get me in for the flu shot. So COVID-19.
I don't think I got you in this time, if I remember correctly.
You didn't.
That's right. No, it's true. Okay. I didn't know that you had that perspective. I have a few minutes. Is it okay if we talk a little bit more about the COVID vaccine and I just kind of want to explore your perspective about it?
Okay.
Yeah. You were mentioning that you're not sure about it, and you also mentioned that you're not trusting. Could you tell me a little bit more about that?
Yeah, since they've been talking about this vaccine, like I get it. I see how COVID has definitely the impact of COVID on the entire population. And then I also, like I said earlier, my aunt passed from it, and I know other folks from the community. And while I want to be healthy, right, and I want to guard myself against contracting COVID-19, the vaccine, it just feels so new. Even with the research that I've done, I don't know. I'm just really not trusting. I think it's almost the same way that I feel about the flu shot. I'm one of those. It's like, well, if everybody else is vaccinated, then I should be okay. What's the impact? What is the long-term impact of this vaccine? I don't think we have enough information yet. That's where I am.
You're feeling some distrust about the information that's out there about the vaccine. It's new. There's a lot of unknowns that we in medicine don't have answers for.
Yes.
And so that's why you're hesitant.
And
Yeah.
you know, the medical profession hasn't really been nice to people who look like me.
It's true.
To be honest with you.
Yeah.
You know, when I think about,
Yeah.
you know, while there, you know, doctors have made great strides in medicine, a lot of it was on the bodies of Black and brown people. So
Mm.
I don't know. I'm just not trusting.
Yeah. I wonder if you've been on the personal end of discrimination and bias in medicine.
I mean, I felt like I have.
Yeah.
I felt like I have. Sometimes
Yeah.
it's hard to prove, right? Because you don't know if you don't know for sure, but I know what it felt like. I know what
Yeah.
it felt like. So I felt that. I felt like oftentimes that my voice is not, that you know, that the doctors can be dismissive. Like when I'm saying that, like, this is an issue, it's like, you get the look like, is it really the issue? You know what I mean? Like, so sometimes I feel dismissed, and I don't know if that's because I'm Black or a woman or both.
But it sounds like you felt like you were not heard.
Yeah.
And you weren't respected.
Absolutely. Absolutely. And because, you know, I'm pretty knowledgeable about, well, I know about me. I may not know everything there is to know about medicine, but I know me because I live in this body. And when I'm feeling dismissed, or that the practitioners are being dismissive, I take my business elsewhere.
And your relationship with healthcare institutions and other providers has been such that, you know, they don't hear you. They don't hear you out. They don't respect you. They don't treat you as an equal. And then, you know, just historically that there's been this legacy of, you know, medical progress really kind of, you know, dependent upon the non-consensual use of Black and brown bodies. You know, and so I totally hear you when you're talking about distrusting, you know, especially these latest developments.
And I don't mean to cut you off, but like, how do I know this won't happen now? Right? Like, so I get the vaccine, right? And I'm experiencing whatever side effects that I experience that may not line up with your research. Like, how do I know I won't be dismissed then? Right? Like, how do I know you're not like, and not when I say you, I'm not talking about you personally, but I know that you represent, you know.
I represent the field.
Field, right? So like, then how do I know that you're not like trying to figure out how this works in Black and brown bodies? Like, I don't know that, right? I don't know that.
Thanks, Emily.
Yeah.
And I forgot to mute, so everybody can hear me okay?
You're good.
Okay. All right, great. All right. So what I'd like to do, I think Emily has the breakout rooms set up, but I'm going to go to my slides. So don't go there just yet. I've got to go to share screen.
And there's a phone number, a 748 number in our participants. If that's associated with you, let me know. So I can make sure your phone number goes to the same room. I'm not sure whose that is, or if it's its own person.
Okay. So thanks, Emily. I appreciate that. So she's got some breakout rooms ready for you. I believe you said, Emily, the Riverstone group is going to be one, and then you've got people assigned. So are they already assigned in each room?
They are. And yeah, Riverstone is together.
Okay. So just as a quick reminder, let's go when we break, when I'm done talking and they're in your rooms, let's go for, I said 10 minutes, but let's try 8 because once part of the 10 minutes usually includes a setup. So, discuss any ors or change talk you might have heard, or notice something that the provider did well, or identify something the provider could do better, and just take a few minutes to see what to talk about what you saw. And we're just literally a few minutes. So, all right, I'll leave that slide up, and Emily, if you can put them in rooms, that'd be great.
Yep, you should have an invite to your room. If you have any trouble, let me know.
All right, well, thanks for doing that. And I just wanted to check in with each breakout room And you don't have to go through everything. Just, I want to hear a couple of pieces of feedback from your group. So room 2 has the Riverstone folks and Kelly, and it sounds like a pretty good sized group. So I was wondering if from your group, if someone could share a couple of things that they heard that the provider did well.
This is Stacy. I've been elected to speak for us.
Lucky you.
Let's see, that the provider did well.
Yes.
He was a good listener. He heard what she was saying. He affirmed well, and he gave her time to say what she thought, and didn't interrupt that or make any, after he realized what she thought about it, he didn't make any assumptions, and he didn't make her feel one way or the other. He was just very affirming.
Okay.
Yeah.
What did your group identify as one thing that he could do better?
Oh, yeah, at the very beginning, he had just had the assumption that she and her mom would both be getting that vaccine as soon as it was available.
Yes. And he had a pretty strong reaction, not the worst. Again, not perfect, but yeah.
And it was pointed out that he made a HIPAA breach by saying that her mom was coming in the next week.
Oh, fair enough. Fair enough. Okay, great. Thank you. And then I'd like to go to room 3 that I have some of the names up. Room 3, if you're not sure who you're in, I have Heidi in there. If somebody from your group could mention a couple things you thought the provider did a good job of.
We've all been here a lifetime. That was
That group 3?
We
Our
discussed
group-
how important it was that the
Okay.
provider gave the extra time.
Yes. Okay. Anything else your group noticed?
I noticed that it was great on the patient's part that she was willing to open up with questions and thoughts,
Yeah.
because we don't always see that. We don't always have that opportunity to let them express themselves, even though we try to make the time.
Exactly. And I think that's the point that we're trying to make, you know, is that he was pretty patient. He was patient. And then the patient took the time to actually say what was on her mind. Okay, great. Anything your group suggested that he could do better? Okay. And then Emily, do we have one more group?
Yep, the room with Allison and Deborah.
Oh, see, oh, okay. Allison and Deborah. So that from that group, could you identify a couple of things you thought he did well and maybe one thing he could improve?
We agreed he was great with understanding her concerns. He asked a bunch of open-ended questions,
Yes.
and he was a great listener. Things that we didn't really like was he assumed she would get her vaccine, and
Yep.
his first question to her not knowing if she would get the vaccine was not open-ended. She could have just answered it as a no without explaining. She just kind of started explaining her own opinion on it.
Yeah. Yeah. And to be fair, sometimes a yes or no question will work out okay. And but sometimes it won't. So good point. All right. Thank you very much. Okay. I'm going to go back to sharing screens. Did I miss any groups, Emily?
Nope, you're good.
Okay, I realize that there's more to talk about, but in the interest of time, I need to get to a couple of other things. We had mentioned a couple of these items, the autonomy and support. And then we also, what I wanted to mention is that at the end of a conversation, you might have a plan for follow-up. If they've decided to get the vaccination, then you connect them to care, or maybe they want to do it that day. And if they say no or are still hesitant, not a hardcore no, asking permission is about autonomy. And here are two examples you might try. Would it be okay if I called you back in a month? Or if they say, well, no, I don't, this is gonna say, and you say, well, if that ever changes for you, here's my contact information and I'll leave that with you. Or would it be okay with you if I gave some information for you to take with you? And at the very end, we're not going to go through all the slides that have some resources for all of you, but some of them are for you as providers, and some of them are items that will be sent in Word documents that you could give to patients if they were interested in getting it. You don't want to force it down, but you could also offer it up to them. I heard there are things you can listen for change talk. We heard a couple in this particular video. I'm just going to mention a couple others. Being able to travel. We had the elderly parent, perhaps a significant other. You might be hearing wanting to stay at work. Confusion. There's so much out there. We heard her talk about it being new. And, to me, if you were able to speak about it being new, that might be a little spot that you could pick out. Nobody talked yet about diabetes, but certainly that might be something you come back to in a future, a little bit more of that conversation. So Emily, if you could play a few more minutes of the video, and then we'll do a quick breakout after that, just looking for something that you noticed well. So why don't you play about 4 more minutes or so of that video?
So I have a lot more questions than I do answers.
Yeah.
So that's why I'm a little bit ambivalent about receiving the vaccine. Now, for my mom, on the other hand, I feel like because she is maybe in a high risk category, I want to do what I can do to make sure that she's around and healthy, right? But when it comes to me, I know it sounds a little weird, but I'm not there. I'm not there.
Gotcha. It sounds like with your mom, you're at this point where her level of risk is high enough that it kind of wins over whatever concerns you might have. Whereas with you, it's kind of like, it's kind of below that threshold.
Yeah.
So yeah.
With all of the conditions that I have, right?
Right.
You're upping my medication as it relates to my high blood pressure and my diabetes, and I get that.
Right.
I get that puts me in a risk category. Like I'm very well aware of that.
Yeah.
So Dr. Burns, that's where I am.
Yeah.
And not really sure what to do to move from this place.
Yeah.
Now,
let me ask you, what would kind of bridge that gap between your threshold of getting the vaccine and your feelings that it might be beneficial to you?
I think time. And what I mean by that is seeing how it plays out with the people who have already received the vaccine. And again, I know it sounds harsh, right? Like, let me see how it works in you first before I get it. So I think time, maybe more information or up-to-date information of, what's happening.
Yeah.
And it doesn't.
So it sounds like it's not just time, it's like time plus information, experience, kind of getting, more of that would be helpful for you in making the decision to get the vaccine. Let me ask you, why are you, as long as your mother's okay with it, why are you feeling that it would be something that would be really important for your mother to get?
Again, she's older. She's 75, right? And she has conditions that make her more susceptible to contracting COVID, right? So like whether it's, or she may not be able to handle it, what I mean? In a way that someone who may be a little healthier can handle. So I think these are some of the things that I'm like, all right, since that's her situation, I'd rather for her to be okay and be good. And I feel like maybe a little bit like youth is on my side. I may be incorrect in that information. But so I know it seems weird, right? Because I'm advocating or I'm okay with her getting it. but
Mm.
I'm just,
Yeah.
I'm just not, I'm really not, I'm okay. I'm not okay with her getting it, but I don't see any other alternatives to keep her healthy.
Gotcha. Gotcha.
And I don't know
Yeah.
how that's different from me,
Yeah. Yeah.
to be honest.
Yeah. Yeah. Sometimes people are in a place of, of thinking that's paradoxical. And I mean, I think that can be part of just being human,
Mhm.
So it
Mhm.
sounds like the risks are so high for your mom, and they could be so devastating, especially given what happened, to your aunt, that you would really want her to get the vaccine.
Correct.
And then age has something to do with it, right? So that, for you, you feel like youth is, is on your side, as well as
Right.
some other things. What other risk factors?
That work, Julie?
Yeah, thanks, Emily. And in the interest of time, I am not going to have you do another breakout room, but I'm just going to, because I have one or two more slides I'd like to share and talk about it. But if in the chat, you could, instead of doing people raising their hands and talking, because I wanted to get a little more response from that first one. So what I'd like you to do is just jot down anything in the chat that you thought he did a good job of, or that he could do better. And we'll just take just a minute or two to do that, because I have two slides I want to pay attention to before we're getting close to wrapping up here.
Valerie says he did great summarizing her concerns to make sure he understood. And you can probably see the
That's
chat.
kind of why I had you stop. I was like, oh, he just did a good summary. That's a good place to
Yeah, I
pause.
was like, nope.
What else? Oh yeah, I can try. Sometimes it doesn't show it all to me. Anything else come up?
I thought it was interesting that she seemed to also know how kind of bizarre it was that she didn't want it, but she wanted it for her mother, but that she actually brought that up. And he said that, that's kind of being human. Like, it doesn't always make a lot of sense. I don't know. He kind of appealed to that.
Yes, and someone just put in the chat, and it only showed me half, but someone noticed this last time, is that he asked, so what would it take to get you from that one spot to another? What would fill that gap? And that is an extremely well done, open-ended question. And I know we could identify several others, but I think you got to see a lot in practice there that that are examples of what we've talked about. So I'm going to go back to my screen for a moment and just wrap up with a couple of other slides that reinforce some of the things we've talked about. Now, so I've talked about, this is actually a listening technique. I feel like listening to learn is something that I've tried to teach in all my communication classes. How many of you, and you don't have to raise your hand or answer, but how many of you are guilty when you're listening to someone? And this might be your spouse, your kid, somebody you work with, but you're already formulating the answer in your head. And let me tell you that if you're already formulating the answer in your head, there's absolutely no way that you can hear what's being said. And I felt like he was not jumping in to try to talk over her and gave her that space. And you all mentioned that. So a guiding principle in my life, I don't always follow it perfectly, is listen to learn what the person has to say as opposed to trying to answer them right away. And that listening is mostly verbal, but it also might be nonverbal. I didn't see it in this video, but something to pay attention to in your clients is you might notice that crossed arms get uncrossed. You might hear an affectionate tone of voice about someone they care about. So you're listening for lots of things. Truly hear their concerns regardless of the accuracy of them or their viewpoint. And also absorb what's being said without taking it personally. And I put that little note because I wanted to make sure I talked about the tips, and I've mentioned them before about comparing it to road rage, to not taking it personally. And when you answer whatever anybody's willing to let you say, if you could say it like I use two metaphors, like you're describing data. This is this is that, this is that, without intensity to it, because that works up the other person and it also works you up. Another metaphor that resonates with people is to answer as if you were describing the weather. And it's sort of like, it looks like it's raining It looks like it's raining pretty hard and I don't want to see you get wet. How's an umbrella sound to you? You know, describe your, whatever, those kinds of things, that you are just doing it, and that the tip, without taking it personally, should ultimately end up in you not feeling so uncomfortable in trying this. So some reminders, I put them at the beginning, of things to keep in mind: compassion, reflection. It's practice, it's not perfection. Try one new strategy. I know when I try one new strategy, I put it on a note card and it's on my desk. And I used that to answer the phones last summer. If I had to de-escalate something, there was one was my go-to. Didn't always work. If you get a flat out no, I've said it a million times, you don't have to take it on. And your 2 to 3 minutes might ultimately end up in some change. Again, increased comfort and effectiveness for you, hopefully. And then I mentioned that there would be some resources here at the end. And so these are going to be available to you post-presentation. And that one at the top that says finding credible vaccine information, I like to share that with people who are doing research on their own and saying, it's something I used to teach in my public speaking classes. When you're doing research, make sure you're considering the source. Here's links specifically for patients that Susan put together. Thank you very much. And then there's an FAQs about COVID-19. And finally, there is a set of resources she put together that's detailed vaccine information for healthcare personnel. And you might find these interesting. Obviously, you can't click on those links, but we will have those available in Word documents to send to you. So I will let Emily wrap up in just a second here. I wanted to give some special thanks to Amy Spetnagel, who was the patient navigator training that I talked about in Colorado, the Colorado Collaborative, and Kathleen Garrett, who helped her develop that. Susan, of course, and Emily for being my tech person and helping me get through all of this in an hour and a half by making it smooth. So Emily, I'm going to let you wrap up from here.
Thank you. Yeah, that's a lot to put in an hour and a half. Thank you all. I've put a link to the evaluation in the chat box. Please take a moment. It's very short. We just want to know what we did well, what we can improve on. We use it because we're going to be generating more of these trainings. So we really appreciate the information. Thank you so much. I will send an email out with resources, and we appreciate you coming.
Thanks, everybody.
Have a great afternoon.